Now, kali iode expectoration is, of mainly two types. So you can have thick green salty expectoration as we just discussed in the patient. Otherwise, you can also have frothy or soap-like set appearance of sputa. Nash gives Farrington's experience of this remedy in pneumonia, right? So he tells us basically, you see, pneumonia has many stages. Okay, stage of congestion, stage of hepatization in which there is red hepatization and gray hepatization and resolution. Okay, and in all these stages, when is kali iode the most indicated? In the stage of hepatization. Totality of symptoms, I'll write it as TOS, is not just the symptoms that you see or the patient tells you, okay? It should have subjective plus objective symptoms. So, hello and namaskar. Today we are going to talk about the remedy Kali iode. We have already studied the remedies Kali carbonicum and Kali bichromicum from Dr. Nash's Materia Medica, and today we're going to learn about the remedy Kali iode and also about the remedy Kali Moor. Okay, but he talks very little about Kali Moor, so it will be very little. But for Kali iode, let's learn what he has to say about it. Okay. While talking about Kali iode, Dr. Nash firstly tells us that it has been greatly abused by the old school. It is given by the old school as a sort of specific against syphilis, or more often, syphilis complicated by the abuse of mercury. And this is very important to remember. So, abuse of mercury, or anybody having syphilis and has been given mercury, or for any other reasons has been given mercury, and that is leading to some issues later on, then you can think of the remedy Kali iodum, right? Okay, so the next thing that he tells us is that in this remedy, this patient has this respiratory condition, condition of the respiratory organs, in which there is hard cold and continued cough, cold and long continued cough and pneumonia, and then you see that this case is now going into TB, going into consumption. And in such kind of cases, which after long pneumonia or cold and cough finally are leading to tuberculosis, we see that Dr. Nash has had many great results. Okay, then what are the symptoms that this remedy produces? So this remedy has cough. Okay, cough with profuse expectoration. So there is cough along with a lot of expectoration, and the expectoration that comes out of the mouth seems to be coming low down and deep in the chest, as if it is coming from the mid sternum region. So it feels like the cough is coming from the mid sternum region. Okay, and then this pain will go from this mid sternum region to back in between the shoulders. So remember this. Okay, the pain feels as if coming from the mid sternum and going back into the shoulders. And what had we seen in Kali Cup? When we learned Kali Cup from Dr. Nash's Materia Medica, we also in that video saw that in Kali Cup there are lower right chest pains and they go to the back. But it's not as specific that they will go in between the shoulders. But in this remedy, it is going from mid sternum to the to in between the shoulders. Okay, so that's there, and along with it, there are exhausting night sweats and great general weakness. So, Kali Carb also has a lot of weakness, and Kali Iode also has a lot of weakness. So, that's the situation: cough with expectoration, well, plus this kind of pain and night sweats and weakness. Now he also explains to us that there are remedies that can be compared with Kali iode for this kind of expectoration that they have, thick and profuse expectoration. It's a very thick and a lot of expectoration. So in this differential diagnosis, we see that there is tannum, there is Kali iode obviously, and there is sanguinaria. So Kali iode has this thick green expectoration with the taste of the expectoration being salty. Okay, so salty tasted expectoration is there. And when we talk about stannum, it has sweet expectoration, but the color is same, thick and green. Okay, so thick, profuse expectoration, which is green in color and which is sweet. And in sanguinaria, we see that the breath and sputa are very, very fetid, even to the patient. Also in sapia and sorinum, very fetid breath and sputa. And along with it, the expectoration, although thick and profuse, but not green. Okay. Now, Kali iode expectoration is, of mainly two types. So, you can have thick green salty expectoration as we just discussed in the patient. Otherwise, you can also have frothy or soap-like set appearance of sputa in these patients. And this is mostly found in edema of lungs or Bright's disease. Now, Dr. Nash also tells us about Dr. Farrington's experience. Okay, so Nash gives Farrington's experience of this remedy in pneumonia, right? So he tells us basically, you see, pneumonia has many stages. Okay, stage of congestion, stage of hepatization, in which there is red hepatization and gray hepatization, and resolution. Okay, and in all these stages, when is kali iode the most indicated? In the stage of hepatization. So in these stages, kali iode is most helpful. It is also indicated when hepatization is so extensive that we can have cerebral congestion or effusion into the brain also due to this congestion. So there's so much congestion that there can be effusion into the brain or cerebral congestion, which we called it also. Now, if this happens, what are the symptoms? Then the symptoms will be such that there is a very, very red face that the patient will have. There will be dilated pupils, plus the patient will become drowsy, and in this stage, you'll feel that this exactly looks like belladonna. So you'll feel that maybe I should give belladonna, right? But there will be no relief after giving belladonna. Okay, the patient will become worse. The patient breathes more heavy, and with it, the pupils are inactive to light. And this shows us, because the pupils are inactive to light, this shows us that there's serious effusion in the brain which must be checked, or the patient will die. Okay, so this is not something that he's just advising. This is his experience. He has seen this happening, and that is why he's telling us that this may happen. Now here, there's a very beautiful concept that Dr. Nash puts forward, which also, gives us this idea that reading Materia Medica from old authors is not just reading about the symptoms of that remedy. Okay, obviously there are certain Materia Medicas like Dr. Fatak's Materia Medica or Dr. Borik's Materia Medica, in which the symptoms are given, one after other, and there's no explanation or there's no talk going on along with it. But when you read Dr. Nash's Materia Medica, Dr. N.M. Chaudhary's Materia Medica, there are such Materia, M.L. Tyler's Materia Medica, you see that it feels like they're talking to us, they're just giving us a lecture. And when you read those Materia Medicas, it's like they are, teaching you homeopathy in literal sense, they're just teaching you all the concepts of it, all their experiences, how they feel about any remedy, and it's just way more beautiful then. So what Dr. Nash talks about here is that he tells us, now why did belladonna not cure this patient? You will feel like anybody will think that since what we taught is that totality of symptoms is what is the most important, right? So we have the totality of symptoms matching belladonna. We have the red face, we have the dilated pupils, we have the drowsy patient, and we have the congestion in the patient, which is also a very important pathology, a very important thing that we see in belladonna. Then why is it not happening, right? So we have to understand, even if congestion is there in belladonna, where do we see this congestion in belladonna? And we have to understand that we don't just need to take the symptoms that are subjective, but we need to have subjective plus objective symptoms. So the very fact that the patient is not just in the stage of congestion but has gone ahead to the stage of hepatization, okay, and understanding the very pathology that is there in the remedy is a very, very important part of the totality of symptoms. So the way we perceive totality of symptoms is very important. You have to remember. Okay, so totality of symptoms, I'll write it as TOS, is not just the symptoms that you see or the patient tells you, okay? It should have subjective plus objective symptoms. So if you know that the pathology that the patient has is presently in the stage of hepatization, and along with it you see the miasm, that it has not just stayed into the stage of hepatization but gone into cerebral congestion. Okay, so the brain is also getting involved, there is effusion, also showing you that it is not something that is just happening superficially, it's going ahead very fast. So now this also gives you a hint of its miasm being syphilitic, right? And all these things is what you have to consider into the totality of symptoms. You don't have to just see what you can superficially see, but you have to think, you have to understand, you have to see the pathology as well, you have to see the reports as well. This is how we relate it to even today's day. So that's how it works. And when you see the totality of symptoms in all its aspects and then give your remedy, then that is when you'll see results. Okay, so belladonna will cure if the pathology is of belladonna and then also the symptoms are of belladonna. But if you just see the symptoms of belladonna and you prescribe and not look at the pathology, then you might fail. Okay, This is what he is trying to explain to us over here, and it is a very important concept which many of us as students don't know or don't understand, but it is something that we must to become skilled physicians. After understanding this, let's go ahead to see what he speaks ahead. He tells us that this remedy is antisyphilitic just because of whatever we learnt about right now, okay? And this is indicated in the state of hepatization in pneumonia. But if you think that somebody has pneumonia and there's a state of hepatization, and you just give Kali iode just because, yeah, we know that it is indicated in the state of hepatization, it won't help, right? Because again, relative symptoms has to match. So we need both the superficial symptoms as well as the pathology. One of them will help you, okay? So antisyphilitic remedies that we have are Kali iode, which is a very important antisyphilitic remedy. Many people don't know as students. And we have Merck that is very famously known. We have syphilinum, right? Yeah. And in antisoric we have sulfur, right? We have Kali carb that comes from this group of remedies, which is the antisoric remedy. In antipsychotic we have Thuja, we have Medo, we have Natrum sulf. So this is just a quick, little thing that we need to remember. And Heparsulf is a remedy that antidotes Kali iode's overuse. So as Dr. Nash has already told us just in the beginning of the lecture that Kali iode has been abused by the old school. So we need to know its antidote as well. So it's Heparsulf. Okay. Now moving ahead to Kalimur. Kalimur is one of the so-called biochemical remedies, or one of the 12 tissue salts, as claimed by Schussler, okay? And it has not been, proven enough to know even half of its real value, is what Dr. Nash is telling us. Okay, and the most important use that we do of this remedy is in the second stage of inflammation. Okay, the stage of interstitial exudation in any part of the body, and here it is not so far as yet known, right, as much as we know the other remedies, but it is important, okay? And Dr. Nash says that he has seen enlarged joints, okay, after acute rheumatism rapidly reduced to normal size under its action. So we have these patients coming to us, after having had dengue, or any acute fevers and acute symptoms and acute things, and then they come with us with enlarged joints and swollen up joints and fingers and etc. And that is when you have to think of this remedy as well. You can probably give a indicated remedy in potencies, but you can also give this remedy as supportive in Schussler tissue salt potencies, that is 6x or 12x. This remedy is also used for tonsillitis after acute inflammation. So acute inflammation symptoms are checked by aconite, belladonna, ferrum phos usually, right? But after this state of aconite, belladonna and ferrum phos has done their work, then in the next stage you can give a Kalimur, because obviously it is indicated in the second stage of inflammation, right? It is also very famously known to have cured deafness from inflammation and closure of eustachian tube. And the differential for this is mercury dulcus for cases of incurable chronic deafness. Okay, so this is all about this remedy that Dr. Nash speaks in his Materia Medica. Okay, so this was the whole series on the Kali remedies by Dr. Nash from his book Leaders in Homeopathic Therapeutics. I hope you enjoyed learning it from his book with his understanding. And let's meet again for another remedy.